It is 2040, and 15 years of strong economic conditions has allowed NHS Scotland an increase in funding to a record level of £33 billion per year. This is used to build hospitals and community health centres, train staff and invest in technology. Strategic investments are made to cater for shifting demographics, including an increased healthcare demand from an ageing population, particularly in rural communities. As a result of these strategic investments, access to healthcare reaches a record high. In 2040, 80% of demand is met without any significant delay. In Golden Pulse, the public are receptive of healthcare technology, which includes the use of artificial intelligence to assist in diagnoses, the targeted use of online medical appointments, and some remotely operated surgeries to alleviate in-person healthcare demand. A limited number of public-private partnerships are used to provide services in these emerging areas. The public are strongly supportive of net zero, which gives the government a mandate to invest in green infrastructure, including renewable energy, electric vehicle charging points, low-carbon public transport, and infrastructure to support walking and cycling becoming the natural choice for short journeys. Urban planning systems are reformed to allow more diversity in land use, so that people live closer to schools, shops, places to socialise and healthcare centres. NHS Scotland has invested in renewing its vehicle fleet, which is supported by a comprehensive electric vehicle charging network. By 2040, 100% of NHS vehicles are zero emission, which includes some electric unmanned aircraft, or drones, for some deliveries in parts of Scotland. There are improved public transport services and safe cycling and walking routes to NHS sites. This allows the public to shift away from car dependency to public transport, walking and cycling, relieving pressure on hospital car parks and reserving car space for patients who need them most. It is 2040, and 15 years of strong economic conditions has allowed NHS Scotland an increase in funding to a record level of £33 billion per year. However, this investment has failed to produce better results due to workforce shortages, rising chronic illness, rising costs of healthcare, and inefficient spending. Many large centralised hospitals are built in Scottish cities, but this fails to cater for an ageing population who increasingly move to rural communities. As a result, access to healthcare in Scotland falls to a record low. By 2040, only 30% of demand is met without significant delay. Significant investments are made through public-private partnerships in digitisation and healthcare technology, but the public are not receptive to these changes. Artificial intelligence for diagnoses and remote appointments fail to deliver, as they are seen as inferior to in-person appointments and having test results reviewed by doctors. Because of this, investment spent on digitisation and technology is perceived as wasted by the public. In hypertrophic system, the public are sceptical about net zero, and as a result the government lacks a mandate for action. By 2040, transport and environmental policies in Scotland are sparse and disjointed. Though the renewable energy sector continues to grow slowly and electric vehicles become steadily more popular through market forces, there is still a dominance of petrol and diesel as transport fuels. Car dependency continues as the public are offered no real alternative to driving. The NHS investment in fleet renewal is held back by weak government environmental policies, including a patchy electric vehicle charging network. 80% of NHS fleet vehicles are zero emission by 2040. which includes some electric drones for small deliveries in rural Scotland. It is 2040 and Scotland's economy has deteriorated over the last 15 years. As a result, annual NHS Scotland funding has been cut to £20 billion, its lowest level in 20 years. Whilst the funding is limited, it is strategically spent on community-focused healthcare projects and coupled with wider government initiatives that support lifestyle shifts amongst the population. People are eating better diets, exercising more, and most are using either public transport or are walking and cycling for shorter everyday journeys. This, together with a wave of young immigration to Scotland, has reduced the demand on our NHS. As a result of the lower rate of disease and the short physical distances people have to travel to community health centres, access to healthcare reaches a record high. By 2040, 80% of demand is met without any significant delay. In triage efficiency, the public are receptive of the modest investments made in healthcare technology, including increased digitisation and the targeted use of remote appointments where they make sense for patient care. These investments have been made through a small number of public-private partnerships. Although the climate-concerned public are supportive of decarbonisation efforts under a just transition to net zero, the weak economy holds back the Scottish Government's ambition in their environmental policies. However, investments are prioritised in sustainable transport, including planning reforms, public transport and infrastructure to support increased walking and cycling. Electric vehicle charging infrastructure suffers from underinvestment and as a result is largely led by the private sector in an uncoordinated and piecemeal fashion. This limits how many NHS fleets can transition to electric vehicles. As a result, only 80% of NHS fleet vehicles are zero emission by 2040. As part of wider lifestyle changes in the triage efficiency scenario, the public embrace public transport, walking, wheeling and cycling for local trips, including those to access healthcare. It is 2040 and Scotland's economy has deteriorated over the last 15 years. As a result, annual NHS Scotland funding has been cut to £20 billion, its lowest level in 20 years. Due to the increasing cost of delivering healthcare to an ageing population with high rates of chronic illnesses, access to healthcare falls to a record low. By 2040, only 30% of demand is met without significant delay. Investments in digitisation, remote medicine and artificial intelligence are limited by the constrained budget and are delivered using public-private partnerships. There are some high-profile cases of missed duties of care following the use of digital technologies, and as a result, the public are sceptical of the place of technology in healthcare. In critical condition, the public is not supportive of net zero, which leads to funding cuts in the support of energy and transport decarbonisation in Scotland. Energy, including electricity and transport fuels, is increasingly expensive, and disjointed policies hinder the rollout of electric vehicle charging infrastructure. Continued car-centric planning and a lack of investment in public transport and walking and cycling infrastructure prevents most people from adopting more sustainable modes of transport. NHS investments in fleet renewal are limited by the small available budget and disjointed weak environmental and transport policies. Patchy electric vehicle charging infrastructure means that the electrification of NHS vehicles is limited to a few large urban hospitals that are able to leverage private sector investment. By 2040, only 50% of fleet vehicles in the NHS are zero emission. Cuts to bus services and car-centric planning processes prevents most people without a car from easy access to NHS services. NHS hospital car parks are nearly always very busy.